So I'm gonna go above my 2.
Yeah.
Right?
Yeah.
Go all the way down. So I'm gonna get the 410. I believe.
11, yeah.
Do I have to go further down?
That looks good to me.
Okay.
We're just gonna select it. Oh, he wasn't pulled up. It's not your fault. Hold on. Oh, who put him in there twice? This has been x-rayed before. Okay, so we're gonna do. Okay. Okay, so button is out there, out of the room. Great.
410.
Yeah.
Yeah. I don't think you have to show the x-rays.
No, you don't. And just focus.
He didn't fucking lie, you bunch of fucking lies.
So you click on 9 and drag to 8. Oh, below.
Oh, yeah.
There. And then that. Great.
Okay.
Okay, so we got the crown. So what changes are we gonna make?
So I'm gonna put I have to put the plate in.
Yes. Okay. Great. Okay, we're gonna move on to 5, 6, 7. So we're gonna switch to bisecting angles at this point. So you're gonna use the tongue as a pillow. Yeah.
Underneath.
Yeah.
Bridge there.
Yeah.
And then above.
Mm-hmm. You just want to keep, because of this beam, you just want to keep it
Angled.
angled. Yeah.
Okay.
Perfect. It's selected. Sorry, I did that.
Okay.
That's good. So 5, 6, half of 7, but you got the other half before. So
Okay.
you're gonna do the canine, which I will select here.
And then that one I can just bring out slightly further. Right?
Not too far because you don't want to miss the root, but yeah. And then that one you had, like the way you had this before was for a canine.
So this. Like
Yeah.
This.
And then just keep in mind that we want to go, so this is the correct angle this way. You want a 45-degree angle for the horizontal angle. So we'll just come at it at a 45 like this. Just so that we get, because the root is going this way.
Great.
Does that make sense?
Yeah.
Okay.
And then canine selected.
Okay, we're just missing the apex, so we're just going to do a small adjustment. That's a great x-rays of the incisors, so you've got those.
Okay. So then further in.
Yeah, and then this probably needs just, like, the root is further than you think, so it probably just needs to be pushed towards the tooth. Yeah.
Okay.
Perfect x-ray. So you already got the incisors here, so we're going to move to the other canine, so
Okay.
304. Yeah. Okay. Excellent. So we're gonna move on to the maxilla.
Okay.
Jamie, can you just make your tag visible?
Oh yeah. Okay, so now I'm gonna go parallel.
Yes, but there's one more thing. You're gonna go parallel to the palette, but there's one more thing before. You just have to have their heads at 45 so
Right.
that you don't have to come from under the table. He's so sensitive. He might slightly. Just gonna give him a minute there.
Did I disturb you last night with sending good trouble reels to you?
No, because honestly, I turned rotation off of my
And then this one I go.
Straight onto the palette.
Oh no, really?
so I forget.
Yeah. Is it as far back as
That's
you can go?
good.
Yeah. Oh, he doesn't have much teeth there for you.
Yeah.
That's gonna be harder.
Does his mom have
And
different
then I
little
come
videos?
this way.
Yep.
Oh, it's just like a lot.
That's excellent. Yep. We'll just.
I was
if
like, almost
something
every
needs
one
to
I watched, I
change, it'll
wanted
be
to
his
send you, and I
head
was like,
angle.
okay,
but
I'm
it's
just gonna
okay.
send her like one in three. I wonder which side you'd be like, I know
Mine
you're
was like-
Canadian, but like, we
when I
can
was
use your
already
help
in
up here.
high
Could you just help us out a little bit?
So you have a really good one of 8, which is not there. We kind of probably need a little further for 10, which is also not there. So
Deal.
it's not easy.
Yeah.
Morning.
I think you just need to move this guy back. Because your plate, as you can see, like is
Okay, I'm
far
just gonna
back
empty
enough.
his physical exam and then we can call owners.
You can select 110, which is the last one. Excellent. Perfect. So then you want like 5, 6, 7, so the front ones. And then, sorry, we're gonna just get a little short pause and we're gonna put in some vitals.
She's so dark that she like blends in with like the dark one.
Sorry about the video there.
What if she's like missing? She's with me. I'm just kidding. I've never seen
Okay, I'm just gonna look at Slinky so that that's all done. Oh wait, no, not. Where is Slinky? Yeah. We can just do sedation reversal. You big papillons, you cute. You big papillons.
Okay, sorry about that. We can step out. That's selected and that's correct positioning.
a dog that like walks down another hallway that he saw.
Okay, so as you can see here, there's a lot of plates. So just pushing in the plate, you'll get those roots. Yes, but you're aiming for this too. So bring it as close to the canine as you can. Yeah, that looks good. And then just because I don't know if you see, but his head is kind of like angled down a little bit. We're either gonna have to we can't push this down because of the table. So we're just gonna bring this towel so that his nose just is up, and then you'll get it.
Okay.
Does that make sense?
Yeah. Yeah. Okay. So now the other side.
Yes.
Okay. So same process.
It is 9:19 on, is it Thursday? Thursday, February 27th. Dr. Amy Thompson is calling Rhody Leggett's owners to give them an update on her oral exam this morning.
Hello?
Hi, good morning,
I
Connie.
need to go more on.
Yes.
Hi, everything
No,
is
you
great
had it
over
right. I
here.
would have just
No
gone further
worries
back.
at all.
Yeah, just to get the plate, the whole
yeah,
plate.
yeah,
You would have
I
got
can
a
send it
half plate there.
express
And
through
then
the phone.
we're
I just
doing
wanted to know
3,
everything's
11,
going
3, 10, so the last 2 on the bottom.
Sorry, it's Dr. Amy. I just wanted to give you a bit of an update because I examined Brody this morning.
Oh, good.
Yeah, so actually, his adult occlusion is now normal. So his lower canines are not hitting the roof of his mouth anymore.
So you have a perfect 9. We're gonna try and get a little further back for
I know.
11.
It's, it happens very rarely, but that's
There's
obviously why
gauze
we do
beside
our
you. If you need
exams
to put that
first thing
plate in there, on your
before
right.
we give any sedation. So, and as well as from what I can tell, the baby teeth on the top, I think you'd mentioned to Minot, look to
And
have
move this
fallen
back.
out.
I would
And
just
so
angle your plate
at
like
this
that.
point, we have a couple options.
Just,
We
yeah,
could
that's
do
perfect. And then
absolutely
that was
nothing
at the right
today.
spot, so I would just push it back where it was.
The other option we have is we could give him some sedation and
We're
take
trying for
x-rays and
11.
just make sure
Perfect.
the entirety of those baby teeth out. Because sometimes I find what happens is when those baby teeth persist for a period of time, sometimes
so then
they'll
you're gonna
get
do
some
7,
resorption
8.
and fracture sort of at the
3 or
gum
7,
line,
3 or
and
8.
there may
Sorry, I
still
should
be a
use the full
root in
numbers.
there. So in an ideal situation,
You're definitely
I would
gonna need
at
the
least
gauze
take
to push that behind the
x-rays
teeth.
to make sure that the entire root of both of those baby teeth have
So,
exfoliated.
You're
or
going
come
for
out.
7 and
Okay,
8.
yeah, that
And so
sounds
you
good.
That's
like
okay, okay. 'Cause,
you're
I
gonna
mean,
want
you
to
take
like
the
push
x-rays
it
and they're
here.
gone, but
So
then at
gauze.
least we'll know with 100%
Yeah.
certainty. Because what I don't want, obviously, and I'm sure you don't want either,
where
is
your
that
finger
if they
is?
fractured
Yeah.
and there's a root in there, that it become a problem
Excellent.
down the road.
So
Exactly.
see how it stays
So
behind
what
with that
we'll do
gauze
is,
there?
yeah,
That's why.
adjusted
Yeah.
the estimate. So we're looking
And
at
then
about
just how you use
$600
Sure.
to
Yeah.
do
Excellent.
his sedation and take those x-rays. So obviously much less cost than what we
Yeah.
were
The roots are
anticipating,
up here.
because his adult teeth that we were going to shorten
Yes.
and do
Good
a vital
adjustment.
therapy on do not
Okay.
require any treatment.
Oh, that's good news.
Yeah, very nice news. It so rarely happens, but every, one in 100 or so, will with time.
Perfect. So that's
kind of
8,
resolve.
7. You're kind of missing this
And
root, but we're gonna
so
get it
part
on
of
the next
that is
one.
probably because the baby teeth,
So you're
at least
switching
the
to
crown,
bisecting.
if not the whole teeth,
So
fell out.
tongue
so
as a
that there
pillow.
was room for the upper adult canines to move back a bit to make room for the lower. So it's sort of like a domino effect, so to speak. Yeah, so I figured because he's already here, I just wanted to make sure that you were both comfortable. Is what we'll do is we'll just sedate him, give him
So
some
then-
heavy sedation, take
Yeah,
x-rays
maybe
to
a
confirm
steeper
those
angle.
teeth are missing, and if they are,
Yeah.
then we'll reverse his sedation and then he can go home. If we take x-rays and find them there, then we'll go ahead with full anesthesia and remove those teeth. So I'll call you if we find them, just to update
So,
you on what the cost
We're almost
will
never
be.
just missing the roots, so it's
But we're
probably
gonna be cautiously
we'll check. It's
optimistic
either
that they're
plate needs to
truly
be
gone.
further or angle needs to
Okay,
be
that
steeper.
sounds good.
But if you
Okay,
look, the plate
wonderful.
looks to be in the
Just
right
want to give
spot.
you that update. Also,
Yeah, so I would
he's huge. He looks like a grown boy now.
More over the mandible. Yes.
He's very good. I
Yep.
mean, he's so busy and wants to jump all over you, but listens very well when you ask him to sit. And our records say he only gained 2 kilos, but he looks like he's huge. Yeah.
Mostly it's fur.
So you already have that
That's
canine.
exactly
We're
what
switching to the
Casey just
maxilla.
said at the same time as you did. It was like, it's all fur. But yeah, he looks like a distinguished gentleman versus the little baby that we first met in the fall. So, anyways, he's doing great. He's set up in a little house, seems quite comfortable and happy. So it'll be a little bit until we do his sedation, but just wanted to call and give you an update on my exam findings this morning.
Okay, great. Thank you very much.
Of course, we'll update you once we have more information.
Okay, thank you.
You're welcome. Bye bye.
Bye-bye.
Sorry. Head up 45. You're doing so good. Yeah.
And then
Yeah. Perfect. Good job. Yep. Okay, that's okay. So you have the crowns but not the teeth.
Thank you.
I think so. If you look at yes, I might just have to shift his body a little bit for you so his head can actually stay at 45 there, and then we'll back this up. Unfortunately, by moving his head, your plate came out a little bit.
See, I think is reasonable, mostly because everyone's been starting this week, is that we could, in tandem, start Brody
Good, show
and
me
start
just a smidge more first 45.
because
Yes.
even if the baby teeth are there, it's still a much shorter procedure. That like I can get those teeth out while we're getting simply set up and CRIs and like all that stuff. Instead of waiting to put that.
Great troubleshooting. This is excellent X-ray for 9-10. We're gonna go to 8.
Okay.
I'm gonna save this with like still a shitty X-ray, but because it's gonna be in her video, so just leave the bad X-rays there. We fixed them. Just leave them there. We have to send them to asterisks.
Oh, okay.
that's good.
Remember, we're going for the roots, not the crown.
Okay.
So I would. Excellent. Yes.
Further in. Okay.
So close. We just need a bit more of the roots.
Okay.
So might be like earlier, like you know how we lifted his head up because your thing can go down further.
Yeah.
Yeah, I would bring that pillow forward and put his head up. I can also get you a bigger pillow if that doesn't work. Okay. Excellent. So like they're all just like nodding. Excellent. Okay, 5, 6, 7.
This guy can rotate.
No, that's okay. Just keep it behind the canine because we're still going for 5, 6, and 7.
So
So
just right there.
yeah, again, we're not going for the crown. So like, try to keep it like in like this. See
Yeah.
the difference? Just
Yeah.
so that I can still get the crowns.
Yeah.
Yeah, like I mean, if like if that one isn't bad, I'm happy to do like a survival to like sleep. If they want to sit down, I'm more than happy to do that. But if they're a bit resistant, I'm okay because like obviously our
Perfect.
that's why the intestines happens.
Except that tooth is dead.
Yeah, yeah, we do.
Okay, Anna, you can pause video. We have to switch the whole head.
So I'm doing the tops right. And then we're just doing the incisors, right?
We're gonna do canines inside, but you can start where you want.
Okay. So I'd be rotating this slightly.
For canines?
Yes.
Yeah. You also want to remember that the root is going up in here, so usually you just angle your plate more like this.
Okay.
Does that make sense?
Yeah.
Yeah.
Okay.
Great. Let me just put in these vitals. Amy behind your curtain.
And this is my 3.
That goes 30. Nope, 204. Yeah. You're on the top.
Yeah.
Okay. Good.
Okay.
It's a smidgy short, but good enough.
Yeah.
You can get the incisors. We're gonna go left 3 incisors.
So I'm still gonna have it on that angle.
If it fits, I would put it in between his canines.
Okay.
Yeah. That just like that. Yeah.
And then it goes straight on. Or it's still on my angle.
That
right? 'Cause I
that is
want
good.
that.
Yes. Great. He doesn't have the other
Yeah.
2, but yeah. Okay, so then the next 3. Going for the canine or for the incisors?
The incisors.
Okay. So I think you got just a bit too, pushed the plate a little too far and a bit
Yeah.
too much of an angle. Let's just fix that.
So I'm going further in. And then this way. So I
And then
went
this a
further.
little less. There you go.
Okay.
And then as you can see from the previous one there, this one, you
Yeah.
almost had the canine, so you just needed a little bit more of the apex, so you
Yeah.
know how to fix that now.
Yeah.
Great.
So then just the canine is.
Yeah.
So I'm gonna rotate that way.
And then make sure to push it because it's really long. Yes.
And just slightly.
Okay. That should be our last one, hopefully. Excellent.
Okay.
Good job.
Okay.
We're done.